Hello, my name is Julie Hebert, and I'm with Jim Hall Insurance, and I'm here to give you a brief overview of your employee benefits for the year effective March 1st, 2021. Dentist USA will continue to offer life insurance, vision insurance, and group medical insurance. We'll continue with Blue Cross Blue Shield of Texas, where we'll have three different plans for you to choose from. And life insurance and vision insurance will continue to be provided by the Guardian Life Insurance Company. $25,000 of life insurance is provided for each employee, and this is a benefit paid for by Dentist USA. You have the ability to purchase vision insurance for you and your family. This is paid for you by your payroll deductions. Then you also have the option to purchase medical insurance for you and your family. Dentist USA will pay 75% of the HMO premium for each employee and 25% of the HMO premium for your eligible dependents. And we'll go over what each of those premiums are here in just a minute, but there are three different options. There's a PPO type plan with a $3,000 deductible, an HMO type plan with a $1,000 deductible, and then there's a high deductible health plan that you can combine with a health savings account with a $4,000 deductible. As I mentioned, there is a $25,000 life insurance policy and also includes a $25,000 accidental death and dismemberment rider so that if you were killed in an accident, the total policy would pay $50,000. So one thing we need to make sure that you do is check your beneficiaries each year and make sure you don't need to make any changes there based on any life events that you have. If you do have a change during the year, please be sure and let Doris or myself know, and we can make that change for you. The vision insurance is provided through Guardian Life Insurance, and we have a dentist. Dentist USA has a PPO vision plan. There's some information there about how to go to your provider search and find a Guardian vision provider. If you use someone within the Davis Vision Network, you will definitely receive a higher benefit and pay less out of pocket for your cost. You can go and get your eyes examined for $20 in network, and it'll pay 100%. You can get new lenses every year for your glasses and contact lenses every year for $20. And you can get new frames every other year. So the coverage there is listed for the bi-monthly payroll cost is $4.23 for employee only, $7.12 if you want to cover yourself and your spouse, yourself and your employee, your children is $7.26. Employee and family is $11.50. So again, be sure that you're using someone within the Davis Vision Center because you'll have much better coverage. The medical insurance, as we mentioned, is provided through Blue Cross Blue Shield of Texas, and there are three different plans. The first plan is a PPO network where you have the option to use the Blue Choice network. You have a $3,000 deductible. Once you reach that $3,000 deductible, you pay 30% up to your maximum out of pocket of $8,550. Please notice that there are different copays for hospital stay, emergency room visits, urgent care, and if you have a baby, there's a separate provision for that as well. If you go to a primary care physician, it's $40 and a specialist is $80. You can go and get your well exam every year and it's covered at 100%. So please be sure you take advantage of that benefit. The prescription drug benefits are listed there. Try to use a preferred pharmacy. You're going to receive a better benefit. As you can see there, you're going to have a lower copay. And we also encourage you to use an in-network provider. You do have out-of-network benefits, but you're going to receive a much better benefit from your insurance if you stay in the network. To find a provider, you go to the Blue Cross Blue Shield website listed below, find a doctor, and select Blue Choice PPO network, and then follow the instructions to find a provider for services, doctors, lab work, those types of things. The cost is listed there below for employee only, employee and spouse, employee and child, employee and family. Then the second option that you have is the HMO plan. It's important to know that you'll be required to choose a primary care physician under the HMO, that there are no benefits for out-of-network care under this plan. So it's very important that you choose a primary care physician and have all your medical care provided by that physician. They work as a gatekeeper and they will refer you for other services that you might need that they can't provide through the primary care network. So you would go to the Blue Cross Blue Shield website again, find a doctor, Then you'd have the Blue Advantage HMO network and follow the instructions to find a primary care physician. But you will need that person listed when you sign up. You can change during the year by calling the number on the back of the card or going through your Blue Cross Blue Shield access online. But it's important that you select a primary care physician. If you don't select one, one will be assigned to you based on your home zip code. So under this plan, you have $1,000 deductible. You would pay 20% of your cost once you reach the $1,000 deductible till you reach the maximum out of pocket of $6,000. To go to your primary care doctor, it's going to be $45 a visit, and a specialist is going to be $90. Again, you have coverage with preventative care of 100%, and there's copays there listed for imaging, emergency room, urgent care, inpatient, outpatient services. Again, there's the preferred, non-preferred pharmacy pricing. So again, be sure that you're using a preferred pharmacy. That would include Walgreens, Walmart. It does not include CVS. So make sure that your pharmacy you're using is in network and a preferred pharmacy. The pricing is listed there. The third choice is a high deductible health plan that allows you to combine that with the health savings account. You have no first dollar benefits with this plan. So you pay everything out of pocket up to your $4,000 out of pocket deductible. Then you would pay 20% out of pocket up to your $6,900 deductible. So you can see there you have no pharmacy copays, no doctor copays. You pay everything out of pocket at the agreed upon price that Blue Cross Blue Shield uses up until you reach that deductible. And then you would pay 20% up to your maximum out of pocket. So the pricing is listed there below. So again, important reminders that it's important that you use an in-network provider regardless of which plan you're on. If you're on the PPO or on the high deductible health plan, you're on the Blue Choice network. If you're on the HMO, you're on the HMO network, and you need to make sure that you're finding a doctor and providers within those networks. Again, we mentioned using a preferred pharmacy is another way to save money. Preferred pharmacies include Walgreens, HEB, Walmart, Albertsons, Access Health. CVS is not a preferred provider for Blue Cross. There's also information about using MD Live. This is a service where you can call this 800 number. You can request to speak to a doctor and they will call you back, and they can treat things like minor colds, sometimes scrapes, cuts. They can call in prescriptions for you and you don't have to actually go to a doctor's office. So that's an option. And then also we encourage you to find an urgent care close to where you live and close to where you work so that if you need those services, you'll know where you can go to an urgent care facility that is in network. Be sure you're using an urgent care and not a standalone emergency room. If it has the word emergency in the name, it's going to be treated as an emergency room, and you'll have a large emergency room copay to go along with your visit. If you use an urgent care facility, you're paying a much lower copay. Part of what helps keep your costs down is the pre-authorization requirement. So be sure that if you're having any complex procedures done, that you have that pre-authorized through the insurance, and it will make it work much better. This year, we are doing your open enrollment through EASE again. If you'll remember last year, we did that. It works pretty well. We have until the end of February. I know this is kind of a short time frame, but with the cold weather and the emergencies that we've had going on with COVID, everything is kind of rushed this year. But I wanted to let you know that we are doing that EASE enrollment online. So please log on and try to get your enrollment completed. I'd like for everyone to complete the enrollment, even if it's just a review and click, and your selections that you're currently enrolled in will appear as you go through the screen. So if you're already enrolled and don't want to make any changes, it should be a very quick process. Log back in and get through the process very quickly. Again, my name is Julie Hebert with Jim Hall Insurance. My information is listed there, my phone number and my email. Be happy to help if you have any questions or any problems at all. Thanks so much.